Welcome back to Transcriber from Reddit. Today's topic actually originally came from a magazine I got, a Woman's World issue. In it, there is an article titled, "Is Your Doctor Gaslighting You?" written by Stacy Colino. I took pictures of it, as you can see here, on the off chance that the original article would be hidden behind a paywall. Then, after Googling it, I found it on the website firstforwomen.com. It's under their health section. Again, the title is Your Doctor Gaslighting You? How to Tell and What to Do About It. Underneath that is a subtitle, Healthcare Professionals Routinely Dismiss, Downplay, or Question Women's Concerns. What You Need to Know. Written by Stacy Colino, updated June 25th, 2024. Underneath that is an image of a doctor facing a woman. The doctor also is a woman. However, the doctor's face looks like it's etched between a myriad of curiosity and suspicion and perhaps a little bit of derision. And the woman she's facing, the patient, is covering her face with both of her hands, looking like she's ready to cry. Below that begins the article. You've probably heard of and maybe experienced gaslighting in a personal or professional relationship, but you may not recognize the extent to which this kind of behavior can happen in the healthcare arena. In what's often called, quote, medical gaslighting, end quote, health professionals essentially dismiss, downplay, or question patients' concerns about their symptoms or overall health. Research shows women are more likely to experience this than men are, linked here. And it happens across an array of health conditions, particularly with pain, chronic fatigue, fibromyalgia, and reproductive health problems, experts say. Below that, we pass by some ads to continue reading. Quote, women are more at risk because we've been socialized to be people pleasers, so if our symptoms are dismissed, we're less likely to push back, end quote, says Jennifer Wider, MD, linked here, a women's health expert based in Connecticut and editor of the book The Savvy Woman Patient. Quote, women have had a long history of having medical problems dismissed and attributed to an emotional state, end quote. Section, doctors don't always listen to women. In a 2023 study, researchers from the University of Connecticut analyzed narratives from patient-provider interactions involving nearly 400 women with poorly understood chronic pain conditions, linked here. There was a high prevalence of discrediting, silencing, and stereotyping practices in these conversations. Besides the fact that this treatment didn't help the patient's pain, it often led to a delayed diagnosis and made the women feel worse emotionally. Quote, I don't think medical professionals are trying to manipulate people's sense of what's real in a nefarious way, but the effect is the same because it creates because it creates a mistrust in the self, end quote, says lead author Elizabeth Hintz, PhD, linked here, an assistant professor of health communication at the University of Connecticut. The key to dealing with medical gaslighting? Learn to advocate for yourself. Read on for advice for how to do that. Section, problem. Your doctor dismisses your symptoms as being related to stress, age, or diet. You think they're more serious. Below that is an image of a relatively young medical professional facing an older female patient. We don't get to see exactly what the expression is on the older female patient's face, but the female medical professional's face looks either like she's listening intently or there's some condescension on her face. I continue reading. Quote, We're the best judges of our bodies, and we know what's out of the ordinary and what isn't, end quote, Dr. Wider says. Quote, trust your instincts. Repeat your concerns until you feel heard, end quote. It can help to add, in italics, I would really like to make sure this isn't more serious. How can we do that? End italics. If you don't make progress with that doctor, seek a second and perhaps third opinion. Quote, start the appointment by saying, in italics, I've talked to doctors about this before and haven't been believed, end italics, end quote, advises Sarah Fraser, MD, linked here, a family physician in Halifax who has written about gaslighting in medicine. Quote, as healthcare providers, that makes us pay attention and make sure we don't do that to people, end quote. We is in italics. Section, the strategy that saved one woman's life. That's what Pat Roque ended up doing after she began experiencing mental fogginess, confusion, balance problems, fatigue, muscle weakness, and movement difficulties in 2021. Quote, my brain was not working right. I was losing my memory, my words, my ability to tell a simple story, end quote, says Roque, now 60, a professional speaker and career coach in Calabash, North Carolina. Quote, I knew something was very wrong, end quote. Over the next 2 years, several doctors dismissed her symptoms as being related to long COVID or hormonal changes, and her repeated requests for a brain scan were denied. Quote, refusing to accept no is in italics, for an answer led me to switch healthcare systems, end quote, she says. The new doctors listened to her concerns and sent her for an MRI that revealed a meningioma brain tumor the size of a pool cue ball. Since having it successfully removed in March of 2023, she has regained most of her functions. Quote, practicing what I teach and advocating for myself truly saved my life, end quote, she says. Section, problem, appointments are too short for you to bring up your concerns. Below that is an image of an older woman patient talking to a middle-aged woman medical professional. They both seem to be in deep conversation over what is on the medical professional's clipboard. Research shows that doctors interrupt patients after an average of 11 seconds, linked here. That's why it's important to prepare ahead of time for the visit. Write down your symptoms and questions and prioritize your top 3 to 5. Quote, report your symptoms in concrete language that describes what's happening and the impact it has on your life, end quote, Hintz advises. You could say, in italics, I'm experiencing intense lower back pain that feels sharp or stabbing. It limits my ability to work and drive, end italics. It also can help to bring a supportive friend or family member who can provide another pair of ears and help you feel empowered. If you have an extensive list of concerns and not enough time to address them all in one visit, you can hand the list to the doctor and ask for a follow-up appointment. Section, problem, you're not comfortable with a medication or test your doctor recommends. Below that is an image where we see a medical professional's hand offering a pill bottle to a patient, and the patient in response is putting up their hand in the sign of no. Palm out, facing towards the medical professional. Universal sign for stop or no. It can feel difficult to question a doctor's recommendation, but it's vital to do so, Dr. Wider says, so it's wise to prepare for this possibility ahead of time. She suggests writing a script for how you could approach a conversation like this tactfully and practicing it in front of a mirror. If you get test results on a voicemail message or through the patient portal and you have questions, call and ask to speak to the doctor. The doctor is unlikely to be available immediately, so, quote, ask to be called back. You may have to wait a day or two, but it's your right as a patient to be called back, end quote, Dr. Wider says. If it doesn't happen in a reasonable time frame, call the nurse line and enlist the nurse's help in getting more info from the doctor. Or you can use the patient portal to communicate with the doctor, Hintz suggests. If you continue to feel dismissed, quote, it's time to look for another doctor, end quote, Dr. Wider says. Quote, find a doctor that takes their time with you and that you feel comfortable with, end quote. They're out there, though it may take perseverance to find them, as Roque discovered, but it can mean the difference between getting the right diagnosis and treatment and not. Here ends the article. At the end of the article, there is also a statement that reads the following. This content is not a substitute for professional medical advice or diagnosis. Always consult your physician before pursuing any treatment plan. I want to thank the author of this article for writing on such a difficult topic like this. And I want to thank the people that she talked to in preparation for the article and linked here in the article. As important as it is to get a good relationship with your medical professional, with your doctor, with your provider, with your nurse practitioner, it's even more vital to know how to get your symptoms the honest look that they need. And sometimes it's really easy for medical professionals that you are comfortable with, that you've been going to for years, to immediately dismiss them or think of them as no big deal. Or when you get transferred to a new medical professional and that medical professional doesn't take you seriously, it's very easy to feel dismissed and lonely. It is sad that this is where we have to go as women to find information to help us get the information we need from the medical professionals, or in order to get the steps we need to be taking to get on that path. It's so frustrating that there isn't this kind of information when we're in the doctor's office and facing that doctor, that medical professional, and being told, well, I don't think it's that serious, or being told, well, I think it's all in your head, or being told, I think you're just being too emotional. I'm sure you, like me and many other women out there, go through this feeling a lot. And you probably have stories you could share of really demoralizing visits with medical professionals like I can. This is to remind you that that doesn't have to end there, that you can take it further and you can make a difference in your own life. And if you're having trouble doing that, take this information, go to a friend, go to a loved one, go to a trusted friend or member and talk to them and ask them for their help with this. Do some practicing beforehand so that when this happens, you will be ready to take some control back in your life. This is all I have for today. Thank you for watching and listening, and I will see you in the next video. Thank you.